Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. It's my honor to be back with you today as part of our ongoing Friday video series where we give you updates about what's going on in our healthcare world. Let's start with the J&J vaccine rollout. In our last video, I talked about the state's plan to roll out those to targeted industry groups. Those would be law enforcement, fire department, grocery store employees, and food and agriculture. They were going to work at the county level to try and set up regional clinics, or the counties could work with a vaccine provider like us to take care of that. So we were working with both Washington and Greene County, getting prepared to do that for our region. Unfortunately, as you probably heard, there's been a disruption in the flow of J&J vaccine coming to the state, so that program has been completely scrapped. The little bit of J&J vaccine that's going to come to the state will go to the federally contracted pharmacies for them to handle and distribute. Now, last week, Pennsylvania Governor Wolf announced that they were going to be making changes to the phase rollout to try and achieve President Biden's goal of having every American eligible to sign up for the vaccine by May 1st. This week, the state announced changes to those phase rollouts. So starting Wednesday, March 31st, every one of those targeted groups, again, law enforcement, fire department, grocery store employees, and food and agriculture, can now sign up to get the vaccine immediately. Then on Monday, April 5th, we're going to be opening it up to phase 1B eligible individuals. Monday, April 12th will be phase 1C, and then Monday, April 19th will be all remaining eligible Pennsylvanians can sign up. So we're getting ready for that as well, and it was a good time for that. We had over 40,000 individuals sign up as part of phase 1A on our website, and we've gotten to the bottom of that list, and so we're ready for the next batch as well. So this makes total sense. And I know talking to other Pennsylvania vaccine providers, they're ready as well. So if you're one of those phase 1A individuals who has not gotten the vaccine yet, please sign up now. Go on our website this weekend, sign up before all those other individuals are eligible. We want to get you taken care of. If you want more information about this, of course, you can go to the Pennsylvania website, pa.gov, or you can go to our website, www.whs.org/COVID. You can have more information. You can sign up for the vaccine. So again, if you're phase 1A, please sign up now. For those individuals who are eligible under phase 1B, the website's going to be ready and open to you starting on Monday. Please sign up at that point. Let me move on to our next topic, talking about holiday safety. We know this weekend there's a number of religious and cultural activities taking place, and we want to remind you to remain safe. We've all been hearing about the potential for a fourth surge, and there are areas around the country where they're absolutely seeing that, including places like Michigan. But locally, we're starting to see the number of outpatient positivity rate go up slightly, and we've had 2 days in a row where our inpatient cases have gone up. Now, 2 days does not make a trend. We'll know in the next week or so whether or not this is a fourth surge and whether we're seeing cases go up, but we can all do our part to try and keep this down, particularly this weekend when normally we'd get together with family, friends, and our congregations. Let's please not do that. The safest way to keep our community safe and keep the cases down is to stay home, do things virtually. Now, I know it's going to be tempting to get together with big groups, your congregation, those kind of things, but let's not do it. Let's celebrate at home, only do things with the people we live with. If you do need to do stuff with people outside your home, be extremely careful. Do it outside if you can. Wear a mask, remain socially distanced. All the things we've been talking about and working hard to do to try and keep ourselves and our families safe, we need to continue to do that again this year as part of a small sacrifice. So celebrate your religious and cultural things virtually. If you do want to make a meal for someone, deliver it to their home, but don't sit down and eat with them. If you have to gather in groups, do it outside. Just small little things we can do to help protect ourselves. We need to continue to do this year in this environment to keep ourselves safe. So just keep that in mind. Now, the CDC has said if you have a group of individuals who are 100% vaccinated, even if they're from outside your home, you can gather in small groups without masks. Or you can gather with groups who are not 100% vaccinated and get together in smaller groups without a mask, but only if every individual is at a low risk of getting COVID and having a serious outcome, bad outcome. Now, it's impossible to look at someone and say they're high risk or low risk. And so again, the safest thing is not to do that. If you're going to get together, again, only get together with 100% of the people who are vaccinated, or not do it all and do it virtually. That's our safest bet. Now, let me move on to our charity ball. As you know, this year we're not going to get together in person. It's going to be a virtual event. It's called the 2021 WHS Charity Ball Virtual Experience. It's going to take place on April 10th at 8 p.m. Unfortunately, it's too late to sign up to purchase the black tie boxes and the craft cocktail kits, but it's not too late to participate and watch or support our healthcare heroes by providing a donation or bidding on the auction items. The auction is going to run Monday, April 5th through Saturday, April 10th. and you can go to www.bidpal.net/WHS 2021 to watch, participate, and have a good time. We look forward to seeing you there. Now let me move on to the DEA National Take Back Initiative. This is a 20-year program, coordinated effort between the federal DEA, state and local authorities, and this year the Washington Health System is going to participate as well. It's a program to take those used, expired, unused medications and prescriptions off our shelves, get them out of our homes, and get them disposed of appropriately to try and keep our community safe. So this year's program is going to take place on April 24th from 10 a.m. to 2 p.m. We're going to have 2 drop boxes at the Washington Hospital, one at the lobby, one at the ED entrance, completely anonymous. You can bring your old medications in their prescription pill bottle. We just ask you to take the label off it. And if you can't do that, just put them in a baggie. You can drive up, drop it in the drop box, no questions asked, get them disposed of appropriately. That'll help keep our community, our kids, our family, and our neighborhood safe. We hope you participate. Now, unfortunately, we cannot take intravenous solutions, injectables, and syringes, but we can take everything else. We look forward to seeing you on that day. Let's clean out our cupboards and get rid of those old medications. Lastly, I hope everybody who celebrates Easter has a great weekend. If you have other events and cultural things you participate in, I hope you enjoy those as well. Again, remain safe, do them virtually. If you do get together, just do it with your immediate family members, and let's make sure that we keep the spread of COVID down. I hope you found this video useful. Thank you for your time and attention. Our next video is going to be on Friday, May 7th. Until then, stay safe.